I want to welcome you guys to the panel today. It looks like we still have some people logging on, so we'll start here in just a minute. Okay, it looks like things are starting to slow down. And so I think probably for the sake of time, we'll just go ahead and get started. I want to thank everyone on this meeting today for joining us. My name is Latonia Rice Sweet, and I'll be your moderator today. I want to remind everyone on the call that today's panel will be recorded. You probably should have seen a notice when you logged on. And we're going to have all participant lines muted, but you're encouraged to submit questions through the Q&A feature on your Zoom. And then we'll kind of gather them all together, group them together and ask them at the bottom of the hour of the panelists if there's time. I want to thank you all again for attending today's important discussion on behavioral health during the COVID-19 pandemic, which has highlighted the importance of fully integrated care and access to high quality behavioral health services. First, I'm really happy to introduce Christina Corriere, Governor Doug Ducey's Senior Policy Advisor on Healthcare at both state and national levels. I want to thank her for joining us to offer opening remarks about her role in the governor's office and the governor's role in addressing issues of behavioral health and integrated care. Christina Corriere serves as Governor Ducey's Senior Policy Advisor. She is a member of the governor's senior staff and also advises on a variety of policy areas, including healthcare at the state and national level, human services, insurance, and child safety. Prior to joining the governor's staff, she held positions including healthcare policy analyst at the Goldwater Institute, chief of staff for Phoenix Councilman Sal DeCiccio, and vice president of government and board relations for a national nonprofit. She holds a JD from ASU, as well as a BS in political science and a BA in history. Ms. Corriere.
Well, thank you so much, and thank you for having me. I am Christina Corriere. I am the governor's senior advisor, and I have had that pleasure of working with him since his administration began in January of 2015. We are thrilled to have Molina Healthcare in Arizona now, and I'm especially happy to be here talking about behavioral health care today. Improving access to behavioral health care has been a priority for Governor Ducey even before the pandemic began. So one of his first areas of focus under behavioral health was on the opioid epidemic. We worked with our legislature in special session to pass what we call the Opioid Epidemic Act that tackled the opioid epidemic from several different angles. But one of the most important things in that act was the creation of what we call the Substance Use Disorder Fund. We wanted to ensure that money was never an obstacle to somebody getting the substance abuse disorder treatment that they needed. So we created a fund and funded it with $10 million to provide substance use disorder treatment for individuals who are uninsured or underinsured. That fund has been very successful, and the funds had dwindled down throughout the preceding 3 years. So during this past legislative session, we were able to put another $6 million into that fund. So it's still there for those who need it. And we know that many of our behavioral health providers in Arizona have tapped into it. We also know that it's important to meet people where they are. So we have worked hard to expand behavioral health on our school campuses. In 2017, at the governor's request, the state legislature appropriated $3 million general fund, $10 million total fund to access our state Medicaid department to expand behavioral health services on campus. And because of that, in the first half of 2019 alone, we provided over 2 million units of behavioral health services in Arizona's public schools, which was more than double the year before. We followed that up the following year by including $20 million in our school budget for schools to hire additional counselors and security officers. One of the last major bills that was passed right before the COVID-19 pandemic began was our mental health parity bill. It was actually passed unanimously through our state legislature, giving the Department of Insurance the authority to enforce the mental health parity law, requiring insurers to report to the department on how they are ensuring that their plans are in compliance with mental health parity and not imposing additional restrictions above what they do for physical health care. It also prohibits insurance companies from denying coverage for services that are covered by the plan simply because they were delivered in an educational setting, so that our kids who are covered by commercial insurance have similar access at the school level to our kids covered by Access. It also created a suicide mortality review team to review each death by suicide and provide policymakers with improved data and recommendations on how to further reduce our suicide rates. It also required the Department of Health Services to adopt discharge rules for hospitals for patients who have been receiving inpatient treatment for a suicide attempt or who have expressed suicidal ideation to ensure that they are linked with the appropriate follow-up services and community resources before they are discharged. And then we modeled another piece of this bill off that substance use disorder fund. We created the Children's Behavioral Health Fund to cover children who are uninsured or underinsured and have an identified behavioral health need from the school to ensure that they get those services they need and that money isn't an obstacle for them. So that Children's Behavioral Health Fund just launched this school year, and we have many schools now referring children to it and kids getting service. Following the pandemic, you know, I'm an eternal optimist. I try and look for the silver linings in everything. And I think when you look at COVID, one of the silver linings that is there is telehealth. You know, the pandemic was very difficult on everyone, but telehealth was a silver lining. While the pandemic, or while telehealth was permitted prior to March 2020, it was used really very sparingly for a variety of reasons. One of the biggest reasons was the lack of payment parity for services provided via telehealth versus the same services provided in person. And that payment disparity meant that providers were really discouraged from investing in the necessary technology to utilize telehealth to its fullest extent. Telehealth is particularly suited for behavioral health care. It is convenient for the patients. It allows more access to specialty care in our rural areas, and it improves access for those with transportation challenges, including many on our Access program. Because of the changes that we were able to deploy as of April 2021, 31.4% of our Access members are actually utilizing at least one telehealth service a month, and we see that the most in the area of behavioral health care. We also had another unique piece to this law that allows telehealth over state lines, so that an individual who is licensed and in good standing in one state is able to provide telehealth into Arizona, and that includes both our physical healthcare providers as well as our behavioral healthcare providers. So it's an area that we've worked very hard on in the last several years, and we know that there's more to do, especially in the area of workforce. But I want to thank you for all that you do, and know that our administration understands that behavioral healthcare is just as important in physical healthcare to ensuring that our population is healthy. So thank you so much.
Thank you so much. And it's really exciting to hear how much behavioral health is in the forefront in the governor's office, in your office. And so we really do appreciate, I'm excited to hear about all of that. And I'm also really excited to get into the important issues that we have for today's panelists. I'd like to let you all know briefly who I am and why I'm the moderator and here today. I'm a behavioral health medical director from Molina. I'm a psychiatrist, an addiction medicine specialist. I came to Molina from the provider side, where I'd spent most of my career, more years I'm willing to admit right now, on integrating care. And when I was doing that, I discovered the importance of having payers working together with providers. I joined Molina due to the fact that Molina has a strong commitment to behavioral health and understands the importance of connecting patients with the integrated care for their overall health outcomes. And I've been excited to work for Molina because of this. And here in Arizona, behavioral health care has played an important role throughout this pandemic, and the panel And this panel will explain how providers and payers are working hand in hand, like I was dreaming of as a provider, to bring integrated care to patients affected by behavioral health conditions across the state. So I really want to thank Molina Healthcare of Arizona and the Molina Cares Accord for bringing together today's expert panelists. And I'd like to introduce them at this time. First up, we have Stacy Garner. He's the Chief of Staff for Integrated Health Solutions at Copa Health. He has 29 years of behavioral health experience. In those 29 years, he served as Chief of Staff, Deputy CEO, VP of Operations, Regional Director, Arnold V. Sarn, Administrator, and Case Manager. Mr. Garner has a Bachelor's of Arts degree in Communications from the University of Missouri and a minor in psychology. His philosophy is bringing people together as one, and he is a true believer of the power of positive thinking in and outside the workplace. We also have Larry Villano is a Chief Executive Officer of Resilient Health. His educational background includes a master's degree in business administration, counseling, and philosophy. He is a licensed professional counselor, a certified business coach, and holds a certificate in nonprofit management from ASU's Lodestar Center. He has worked in behavioral health field for 23 years in a variety of diverse leadership positions. He's worked in both service provider and managed care arenas. He has presented at several local and national conferences, as well as local radio and national television. We also have Dr. Darwin Chern. He's a Chief Medical Officer at Copa Health. He is a triple board certified physician in the fields of psychiatry, psychosomatic medicine, and addiction medicine. He's a fellow of the American Psychiatric Association and of the Society of Addiction Medicine. He is Vice President of the Arizona Society of Addiction Medicine, the state chapter of the ASAM. He has participated as field reviewer for the current edition of ASAM criteria and the ASAM appropriate use of drug testing in clinical addiction medicine, both of these under ASAM. He's a member of the Medical Advisory Committee of Arizona State University, a Center for Applied Behavioral Health Policy, State Opioid Epidemic Response, and is a co-investigator on an NIMH-funded study, My Data Choices, with ASU Department of Biomedical Informatics. I want to thank you all again for being our panelists today. We're very excited with everyone here and for you all taking your time to be part of this. So I think we'll get started. The COVID-19 pandemic has impacted behavioral health in many ways, and behavioral health is an integral part of providing whole person care. Others involved in healthcare ensure patients receive fully integrated care and center behavioral health care in their treatment.
Thank you, Dr. Sweet. Thank you for that question. And let me just start off by saying it's an honor to be part of this distinguished panel today, and look forward to the conversation. I think as far as how to make integrated care, especially behavioral health, center when it comes to our care, there's many considerations that go into that. And as really stepping it up when it comes to integrated care. I think when I think about integrated care, after talking to some of our medical providers, I think three things come to mind. I think in the last 20 years, our primary care providers have learned a great deal about integrated care. I think they understand it and have a deeper appreciation for it. And I think because of that, one of the big things we need to consider is the amount of time our primary care doctors have for their visits. They understand that behavioral health it's very complex, they're challenging to understand, manage, and treat. So thinking about the amount of time we actually allocate to our primary care physicians to do integrated appointments, it might be good for us to look at that and start moving things around. Maybe 15 minutes is not enough time to really work with this particular patient. So that's one point. The second item to really center behavioral health is to make sure those screenings are done. Those behavioral health screenings are done prior to the visit. Things like the PHQ-9, the GAD-7. There's a whole host of screening tools out there. And when I just think about my own experience getting primary care, I don't remember the last time I filled out any of those screenings with my primary care office. So I think really being cognizant of those and utilizing those in the visit is a very big deal. And I would say another consideration, and this doesn't really get talked about too much, is our medical assistants, our MAs. I think our MAs are the glue of what holds our healthcare system together, and really bringing them in on the conversation around integrated care, how behavioral health and physical health interact, and what they need to be aware of, because sometimes our MAs, they might spend more time with our patients than our medical providers do. So I think those three things are considerations.
Thank you very much. I appreciate those. I think we all really do appreciate your thoughts on that subject, especially in regards with time when it comes to providers. So it's clear the COVID-19 pandemic has had significant impact on behavioral health and the ability of providers to give adequate integrated care. Social isolation, a disruption in treatment, and increased stresses on employment and housing has magnified the existing behavioral health crisis. Dr. Churn, how has this changed the way we look at and treat behavioral health?
Thank you very much, and I'm honored to be part of this panel. There's no doubt in our minds that when COVID struck, that this pandemic will change the way we move around in this world. On the surface, we know that we expected that it would increase rates of anxiety and depression, but more than that, I think it emphasized or underscored the need to have a more coordinated care of our patients through integrated care, because during the pandemic, I believe that those who are in integrated care receive better service in terms of their providers being able to coordinate, since they share one medical record. And just imagine on regular periods without the pandemic, coordination has been a challenge, coordination between providers, but with integrated care, with patients being integrated care during the pandemic, we knew who was going to run out of medications for medical and psychiatric treatments. And we're able to coordinate better for the care of the patients. I think that underscores that's something that we should learn from, and we should carry this in our development of our programs. Thank you.
Thank you for that. Now, Stacy, throughout the pandemic, we've seen an importance of telehealth, as Ms. Khoury discussed, and access to a wide variety of healthcare services. How can we ensure those who require behavioral health care have access and the opportunity to receive it?
Well, thank you, Dr. Sweet. First of all, I'm honored to be here, and thank you guys for having Copa Health be a part of this panel. We're very passionate about this pandemic and actually the services that we provide. And it's been an interesting moment, but I will tell you, when you have brilliant guys like Dr. Churn, and we have some regionals and stuff, we had actually put together a task force when this first came out, and we were very fortunate that we jumped on this very, very quickly. As Christina alluded to, we just were trying to meet our people where they're at. And on top of that, we have to know our people, because you got to know where you're at and know how to monitor and adjust and know what to give people where they're at. Some people need to, Dr. Churn and the regionals created, we had services that were just a limited service that were going to be in the clinic, but everything else would have been either crisis services or telehealth, and which was very, very, very helpful for us. But the main key thing here was when we started out, we had to make sure both sides were safe, because we're talking about services, but we had to make sure the staff was safe, our members were safe, and how we were going to do that was actually with telehealth and stuff was actually later. Actually, we found out it was easier for our patients than it was for our own staff. So you have to monitor and adjust those things, and what we do, a lot of people said, well, our folks are not going to be able to use equipment, do all that stuff. You'll be surprised. We've done surveys. We've done a lot of things for our members. We continue to do that on an ongoing basis. Along with, we have an ongoing task force that we meet we were going weekly, now we meet 2 times a week. And we just keep adding and adding to make sure our members are served better along with our staff, because it takes hand in hand. It actually took both sides to really realize, we were both shocked, because we're touchy-feely people in our industry. So it took telehealth and making sure they had the right equipment. And I will tell you, thanks to the, our governor and our health plans to actually help us to actually give our equipment to our members, made this a lot easier task and an ongoing task as it is. Thank you.
Thank you. The COVID pandemic has had disproportionate impacts on communities of color, low-income communities, and other groups that experience health disparities and health inequities. Dr. Churn, how did this impact behavioral health during the pandemic, and how did providers and insurance companies work together to overcome and address these disparities to provide high-quality care?
I think the most significant reply to this is was mentioned by Stacy earlier, because a lot of our people didn't have the technology to access the central solution to how they can continue being cared for, which is telehealth. So we partnered with our payers, and we were able to secure tablets and other equipment, including internet access for our patients, so that they'll be able to continue being cared for. Right from the start, we knew that with this pandemic, we're not going to stop caring for our patients. We knew that we need to continue taking care of them in a safe manner, and it presented an obstacle when they are unable to access the internet. So we resolved that through cooperation with people who can help us. Thank you.
Yeah, access is extremely important. I'm glad you all were able to get that assistance. Larry, as the pandemic began and people start to return to their everyday lives, how can we prevent recidivism for those who started receiving treatment?
Yes, Dr. Sweet. So I think from an integrated care perspective, thinking about it from the context of our primary care providers, I think one thing we're trying to do is look at the role of follow-up visits. Instead of just, we see our primary care provider once a year, really talking about the importance of those follow-up visits and reframing them as not as necessarily as even as a follow-up visit, but as a way to continue the conversation with our clients, our patients, to really help them, to check in with them, and really looking at those follow-up visits as a chance to say, what's been working well? What's still challenging? What successes have you had with your treatment plan? So really that ability to continue the conversation through follow-up visits, because one of the most shocking things out there is around health literacy. HHS views health literacy, or the ability to obtain, understand, and use information to make good healthcare decisions, as a public health problem in and of itself. Some studies will show that approximately 36% of the population, of the U.S. population, around 120 million people, have either a basic or below basic understanding of healthcare, of health literacy. So that's a major problem. And some of the costs associated with that is estimated anywhere between $100 and $200 billion a year is wasted because people don't understand what's going on, what might be wrong with them at that time. And there's preventable illnesses, unnecessary hospitalization, complications that happen from medications. So I think from an integrated perspective, having our primary care doctors talk with our patients about health literacy, making things very simple, understandable, digestible over the course of time. And telehealth, as Dr. Churn and Stacy were saying, that's a great way for us to leverage that technology to continue that conversation.
Wow, that's a pretty big number on the impact, the dollar impact on health literacy. Thank you for that and that perspective. As we've said a few times today, recently the governor signed into law a bill that made individuals with substance use disorders and mental disorders eligible for behavioral health screenings in hospitals. This is especially impactful for individuals who self-medicate, suffer from substance use disorders, who previously could not access adequate treatment. without the screenings. Stacy, how does the still prevalent stigma of behavioral health play a role in treatment and access to adequate care? I believe you might still be on mute, Mr. Gardner.
Okay, there we go. I'm sorry. I was just saying, thank you, Dr. Sweet. I was just saying that people are people. I think what we're getting into is, as we always talk about things, silence in this behavioral health world is a bad thing. People need to communicate, talk about it, and do all those things to bring it to light. We have partnered with the NFL, by the way. So it actually helps us take some of the stigma off about everybody who is supposed to be different or anything else. They're just people. I think over the years, everybody's, and I'm just talking about outside our industry, everybody thought this is taboo. Just don't talk about it. I don't want to talk about my kids' problems or anything like that. The truth of the matter is every household somewhere has a mental illness. Let's just be clear about that. People need to talk about it, bring it out. It's okay to get treatment. It's not a bad thing to get substance abuse treatment. That's how we get better. We are practicing and partnering with folks and talking around people, just not only in Maricopa County, outside of Maricopa County, to talk about these things, because the stigma, especially we treat SMI folks, that's even a different stigma. But I would also tell you, they're just people. And at the end of the day, we take people and meet them where they're at, and we talk about it. People don't say we're going to there's a magic pill to make everything go away, but understanding there is a new normal and it's a good way to live a good life, even with a diagnosis. And just talking about it, stuff like this today, it all helps. But it also got to be okay to say, you know what, I have a mental illness, and talk about it. And people will go understand and go, oh, we're in the same boat. That's just my speech on it. I'm very passionate about that. I don't like the stigma word. People are just people. And that's what we preach at Copa Health.
Thank you. Thank you. I appreciate that. That stigma often keeps people from getting care, and I think integrated care helps with that. And I do also, it's not lost on me that you happen to put the NFL in that answer there as well. So now, Dr. Churn, what are some of the biggest challenges providers face when it comes to delivering behavioral health care now?
I think now that we are in agreement that telehealth seems to be the solution to our problem with providing care for our patients. Even if we found out soon enough that even if you have the technology, laptops, tablets distributed to patients, and but you have to retrain the entire work staff, because it's another way of viewing providing services. So for case managers, we provided scripts guiding them on how to conduct telephonic or telehealth encounters, making sure that they know what to talk about with patients. And even providers, that the physicians and nurse practitioners had to be retrained because they're not used to this new modality of service. We actually developed our telehealth program so we had plans to develop our telehealth program, but because of the pandemic, we had to structure it and launch it in a matter of days, about 4 days, including training of providers. That was a challenge. But then that doesn't end there, because patients also tend to struggle with technology, and they also struggle with using technology for telehealth services. So we organized our peer services so that they provided some support for them, when they try to download Zoom and get challenges. So they have people to rely on. And also we try to teach our patients on the terminologies and what to discuss during telehealth services. So no challenges that are really too difficult to surmount. It's a matter of planning.
Yeah, just providers changing their perspective from how they've done it for a long time. I went through that myself, implementing telehealth. The next question is, prevention is an important component of care when it comes to behavioral health. This is especially true for suicide. Stacy, how does integrated care play a role in the prevention of behavioral health conditions?
Well, Dr. Sweet, there's a couple of things here. You know, as we're very fortunate to have integrated clinics that, you know, having your PCP and your psychiatrist and your counselor all in one spot helps tremendously. You know, along with having crisis plans and knowing your members, but also a key role in this is the family, because, you know, some of the things that we do not see or anything, you got to have, so we know how to treat the whole person. You know, we have Dr. Turner is very passionate. He always has been about suicide prevention, and, you know, teaches our staff. We know triggers, we know those kind of things. But I would tell you, you know, and Maricopa County has been big on suicide prevention for a while. But if you can see the cases, teen suicide, all those things are going up. I think a lot of this is a lot of communication, a lot of things people don't know what, you know, signs and symptoms of, you know, bringing that whole family approach in as together as a unit will help drive that down, in my opinion, my humble opinion. I'm not a doctor, but I will tell you, in my humble opinion, it does work. And having crisis plans does help, by the way.
Thank you. Yes, yeah, crisis plans is essential, especially in vulnerable populations right now. So thank you for that answer. Next, Larry, there are behavioral health and integrated practices that were used during the pandemic that would be useful to continue post-pandemic. And how can we use the innovative modes of care to provide better care in the future?
Well, Dr. Sweet, that's the easy question today is yeah, as we've been discussing telehealth, that is the 800-pound gorilla in the room that we should absolutely continue and grow and develop over time. You know, behavioral health, before the pandemic, we were actually using some level of telehealth. It was mostly individual services, and it was done at, you know, a relatively low level. Psychiatry has been using it for many years. So when the pandemic hit, you know, probably one of the big words for 2020 is going to be the word pivot. It's one of the most commonly used terms, because that's the term that we all hear every day. Is in our industry, we pivoted to really move towards telehealth. So COVID-19 acted as I call it the great accelerant for telehealth. And, you know, for behavioral health, like I said, we were fairly, you know, we used it to some level, but I think the innovation occurred around groups. You know, how can we now do a group on telehealth and create that kind of access? And what does that mean to facilitate a group on telehealth? You know, it requires some new skills, some old skills to make those types of things work. And I think even around group work, the innovative work around group, some of our teams, they've actually developed hybrid models of groups where, you know, because we're all following the CDC guidelines on quarantining. And if somebody in one of our groups, you know, comes down with, you know, some of the symptoms and they need to quarantine for 10, 14 days, whatever it is, you know, they might be asymptomatic and feel fine, actually, you know, but they have to quarantine because they were exposed to somebody who had it. It's all different reasons. So having these hybrid groups where we have some of our individuals in person, you know, with masks and doing the social distancing, but also using laptops and our technology to allow people to engage in those group services from home while they're quarantining has been a powerful piece to keep people connected, because that is one of the, you know, great offsets to all of these mental health bad outcomes, is to have strong social networks, create that, you know, we call it relational wealth. So the technology has been really good to help us do that. And I'm just very proud of some of our staff who've done some innovation around that, doing some art therapy, some therapeutic arts to help people stay connected while they're at home. And then when it comes to primary care, you know, telehealth, it's made the old-fashioned house call cool again. We can do house calls. You know, we can do car calls now. Wherever you are, we can do those calls. And so that's been I think an unintended blessing of this pandemic, is really increasing that access to care. We know that the social determinants of health, sometimes those are much more influential in producing positive or negative health outcomes, excuse me. And, telehealth has really addressed, transportation as one of the major social determinants of health. Transportation is no longer a barrier to getting health. We can use telehealth to talk with our patients and see what their living conditions are now that we can get a glimpse inside of their home a little bit. So what is their home life like? We can talk about food insecurity. Tell me about what's in your refrigerator. Now let's maybe take a walk. Let's take a walk together to your refrigerator. Kind of show me, what's going on in there, and is there a food issue? Because we know good food is medicine. Housing is healthcare. So I think telehealth from an integrated primary care perspective is really helping us address those social determinants of health more effectively as well.
Well, I'm really excited to hear how excited everyone is on the panel about telehealth. I know at Molina, they were very proactive in getting access to those telehealth codes in places, especially during the pandemic. And I think we have definitely seen some improvements as a result of people being able to get telehealth care. And we've actually seen members who were often never keeping follow-up appointments making more appointments during this pandemic than we saw prior to that. So I'm really excited that everyone's embracing telehealth. We think that's really important. And things change, as you said, in ways that we hadn't imagined before and what we can see. Also, I'd like to say, when it comes to integrated care at Molina, we've encouraged integration within our own processes. We have actually, when I came to Molina, that's been my big thing with Molina, is I wanted to make sure medical and behavioral health are both integrated. We never look at someone strictly as a behavioral health member or strictly as a physical health member or their diagnosis. And so all of our rounds are completely integrated, and we look at the whole person when we have our rounds. We also have case managers that are educated on both behavioral health and medical. They're not siloed. But some people do have increased training in specific areas and are available to consult with special services, opioids, different kind of diabetes, those kind of things. But we think this has been very helpful for co-occurring conditions, including those related to COVID-19 during the pandemic. And so we're really excited about, I'm excited about the integrated care approach of Molina and all the things that they have to offer in this area. And I know we've talked about how behavioral health and integrated care has been impacted by the pandemic, and we've discussed the future of behavioral health care. Behavioral health is an important, you've heard me say this 1,000 times, it's been my mantra for, 30 years. Behavioral health is important to a part of full person care. I personally also say I think behavioral is key to all health. I don't care if you have any kind of healthcare issue. I think it's key. And as we continue to address health disparities and strive to bring high quality care to everyone, how ensuring we provide integrated care is going to be critical moving forward. So this question is for everybody on the panel. How can providers and other sectors of healthcare field work to bring high quality behavioral health care to every patient? And what would you like to see?
I think I'm first, Dr. Sweet, on that. It's a great question. I think, and I'm seeing a little bit of it. I think continuing what we're doing, but we got to think about the future. Because even in technology, where you're at right now, you're already behind. Because whatever we're using right now, it's probably going to be something different. So we got to stay ahead of that in the behavioral health world. Also, partnering with other providers, because at the end of the day, you got to evaluate yourself as a company. What do you do have and what you don't have? It is okay, even with competition, because competition is great. Everybody wants to be the best what they are. There's some things that you just may not do so well. So maybe you want to partner with Resilient or somebody at Molina, and everybody's all hand, because really it takes a village to treat people. And that's at the end of the day, just like it takes a village to run a family, no different. I think that's what I love to see and continue going forward. Thank you.
I think Dr. Sweet, I think I'm up next. As far as what I would like to see, so I asked some of our medical providers around this, what would they like to see? And the theme was better information sharing to provide that kind of collaboration, working together that Stacy was talking about. When I think about our HIE in Arizona Health Current, thinking about from when the days when it was starting to where it is now, I'm very, very proud of our Arizona HIE and Health Current. I think when I looked last time, there was like 937 different healthcare providers and other related entities using the HIE. And so it's been an amazing thing having that information. So moving forward, I think having more participation on that would be even better, because even today, little things happen where, you know, if a psychiatrist prescribes some type of psychotropic medication, if one of our, you know, individuals is seeing another, because we have voice and choice in the system, if they're seeing another primary care doctor who's not in the HIE, you know, things can happen from a medication prescribing thing. And so just making the HIE much even more robust than it is today, I think that would be something that we would all benefit from moving forward.
Dr. Chern? Dr. Chern, I believe you're on mute.
Thank you. In terms of what I want to see, it would be, you know, it's hard to provide or maintain good quality or standards of care if you have staff coming from different training programs and different backgrounds. I think we have to invest in training them and updating their knowledge so that they can keep up with changing landscape of healthcare in our world, especially with the COVID-19. It also will provide us with manpower that, you know, that is able to take care of or handle issues that, you know, confront us day to day. I think part of the challenges of COVID is that those trainings that we were trying to provide during regular periods, somehow because of the mad scramble to provide care, and somehow they took a back seat, and we need to go back to retraining our staff and keeping them up to date.
Well, I'm not one shy of opinion, so I'll jump in on this one. And if y'all haven't noticed yet, right? I'll jump in on this one because I'm always rainbows and unicorns and what can we see in the future? And I'll be honest, you know, that a lot of great things that could be out there. And some of the things I would like to see, just from my standpoint, I would really love the further development of collaborative care models, because I think it really gives primary care, you know, that's stuff that I used to work on, really lets us manage a population better. A primary care offices or health system of offices manage people in a better way and gives them greater access to these specialists that are in such short supply these days. So I really, really would love to see that develop further. And it actually be something that I think we're seeing it get embraced, but really more than that, because it's really a definite need. The other thing that I really am passionate about is health homes. Because I really think, and we mentioned it earlier before, I think Dr. Chern mentioned it, that people really do seem to get what I think is better care in these. And if we, as a psychiatrist, some people would only see me as a psychiatrist, and I think more behavioral health as the anchor for health homes. I think that would be wonderful, especially with a lot of our populations, and making sure they get all those different things met, and there's somebody there doing the care coordination and the actual care integration for them. Those are things that I really you know, am excited about the future. And then lastly, you know, value-based purchasing. I think really that is where behavioral health is going to shine. Maybe I'm naive, but I think that's where across healthcare, people will understand and really get how important behavioral health care is to overall health when it comes to getting value out of what they provide. So I'll stop because I'll talk all day on that if you all will let me. So I think we're getting close to the end of time. I've heard a lot of wonderful things. We've heard, you know, about the HIE and health homes and all this stuff. I think we've heard a lot of great things today, and I really do appreciate and enjoy all that you all are doing out there to help members, and are looking forward, everybody looking forward at what we can do. I think that's how we move forward and really improve people's lives. So I really appreciate that. I think we're running close to time to where, you know, if the audience would like to ask questions, please put them in the Q&A section. That's how we're doing that today. And the team will kind of gather those up, and then we'll ask them here in a second.
Dr. Sweet, can I add something real quick that I actually forgot?
Add whatever y'all want.
Well, I just wanted to, just like thinking outside the box when I'm talking about meeting members where they're at, you know, our great Jane Durham of our DDE services, actually, we have mobile gyms that will actually go to people's house. So, and, you know, it is one of those things for thinking outside the box. You got to do, you know, we're thinking our folks are not getting any works out during this pandemic. So, of course, we have gyms inside our integrated health homes. But since we couldn't do that, we brought the gym to them. And so those things, you got to think outside the box and to be creative to help our members out is very, very helpful too, by the way. That's the last thing I wanted to add.
Well, I want to sign up for that. You tell me how. That's a wonderful. No, I hear that all the time. They can't get to the gym, can't get, you know, and that is absolutely a wonderful initiative. I might figure out how I can steal that kind of initiative. Okay, so we do have a question. So, what are the most critical steps states and providers can take to create better behavioral health outcomes for Medicaid and Medicare patients specifically? This is open to the group.
I think, Dr. Sweet, I think one of the biggest things we can do as an industry is really put a lot of time and resources and energy into teaching our workforce how to engage people. I think engagement is the #1 issue that we face. And I know, you know, when I went to school for counseling, it assumed that I was going to have people in front of me. It didn't assume that, you know, my 2 o'clock person may not be showing up or wanting to show up. So I think engagement, focusing first on the relationship, developing that relationship with our clients and patients, really having the skills around that to, you know, as Stacy was saying, meeting people where they're at, going where they're at, literally sometimes, to show, you know, send those cues of safety, to create that trust so that we can have a relationship, so we can even get to the point about seeing your doctor or seeing your counselor or seeing your case manager. I think just for me, that's one of the biggest things that we can do as an industry, is really focus on that engagement and building trust and strengthening that to allow us to move forward, working hard on the front end so the back end of treatment's a little bit easier.
And to add what Larry would say, I would also add the family component is huge. I think in our industry, you got to have the whole package to be successful, and to continue having family members involved as much as possible would be to help our system out tremendously.
Okay, if everybody's answered it that wants to, we have a couple more questions. Let's see. The next question. Are there obstacles in prescribing medication for behavioral health treatment in the integrated care setting?
None to my knowledge. Dr. Chern?
There is none. Even especially during the pandemic, there have been rules that were relaxed, requirements that were also relaxed for getting medications. And the nice thing is with integrated care, you're not nervous as to what the other provider started while you were not looking. That can be dangerous, you know, that because before integrated care, I remember when I was in direct care, I have encountered, you know, like one weekend that the person went to see coverage primary care, and a medication was started, and by Monday it has gone from a regular case to an emergency case. So that's how sometimes that's how important integrated care is, especially during times of crisis, not only in the pandemic but also during the opioid, during Katrina and all those things. That this crisis always underscores the need for good level of coordination.
Great point, Dr. Chern.
And I'll just chime in a little bit. In my experience with it, I think it actually improves it, mostly because having psychiatry also involved in your clinic really helps the primary care providers feel more confident. Well, where often they might not, but then they have someone else that they know they can help with the patient. I think it really does help increase access to behavioral health medications. That's been my experience. All right, next question. Do you think advancements in AI chatbots that aid with mental health crisis will have an impact on people who are suffering from mental health due to COVID-19 isolation and anxieties? Is this sort of telehealth effective?
You know, Dr. Sweet, I would say from what I've seen, these automated programs like Beating the Blues out of England, I think they show some level of success, but I'm always cautious to think about what is the population, who is the population that are using these AI types of treatment modalities to get some help. So I would say for a lot of the folks that we work with in our system, our general mental health and SMI individuals, that these automated self-directed tools can be useful, but just look at them as a nice complement to care, not as replacing care.
I think it's too early to cast judgment on them because I have yet to come across an AI that can potentially replace the warmth of human concern and caring. So.
Yeah, I agree. There's wonderful things coming down the pike, but right now I think they just are wonderful to complement, self-guided things that are in addition to your therapist. As for the replacing, like you said, I agree. We haven't done the studies yet, and that's what we do. We look at if it's effective, how it works. So I don't think we're there yet. All right, next question. What steps can be taken so that universities and campus students can get behavioral health care resources in the future? How can we focus on moving forward with treatment for this group? I don't know if any of you all are involved with university and campus health.
We are not at Copa Health.
I have pretty limited experience working with universities. I know that, as a culture, universities are pretty much self-contained. So they're very, and rightfully so, they're very protective of their students. So I think opening up to behavioral health providers, that would take developing a strong relationship and having a high trust relationship to go into this, the universities in particular, because they have student services and their own counseling departments. Would take some time.
But I also want to add on there, Larry, as I said earlier, the partnership, universities are part of that partnership to talk about those things and say, hey, you know what, we need some help. And, to bridge those gaps, connecting with a partner to have that is actually not a bad idea. We talked about at Copa Health, talking about dealing with high schools and stuff like that. It's a little change to what we do, but I think, everybody needs some help somehow. And that's the things that we need to do to get better, us as a system. Universities is part of our system. So we do need to start looking at those things for us to be better as a whole.
And I think, yes, universities have their own programs. They try to be self-contained, but also there's a lot of efforts from the universities to collaborate extramurally. And that's how I got involved with the committee against opioid overdose crisis, and also some researchers in the university, because they try to reach out to people outside, and oftentimes we contribute a lot of our experience to the theoreticals that they know of. So, and it's always complementary.
A lot of times universities, they can really show the good work that we're doing. Like I remember the Morrison Institute at ASU. I mean, COPA, and we collaborated with them, and they produced a wonderful report to show the power of permanent supportive housing, how it addresses recidivism and unnecessary costs in healthcare, and just the power of it. So that was for us, and I'm sure COPA as well, a good validation of the work that our teams are doing.
And provides us with tools that we can use to advocate for our patients. So yeah, that's why it's always great to work with the universities, collaborate with them.
Well, I think that is our last question. Is there any additions or anything coming to anybody's mind that they want to say before we get ready to close?
I would just say I really appreciate this opportunity. Again, I think this is some things that a lot of people should be involved with. It takes a village, really, and just getting it out there, talking about this stuff, and the behavioral health service, the pandemic. I think it's wonderful. We just make sure that we're prepared for the next thing that happens, which whatever that will be. At least talking about and communicating and collaboration is key. And I would like to end with everybody mask up and get a vaccine. I'll end with that.
Those sound like very good words to end with. Anybody else?
I just want to say thank you, Dr. Sweet. It's a pleasure and honor again to join the panel. I would just, when I was looking at Cleveland Clinic's website the other day, they listed the top 10 innovations for 2021, and right next to gene therapy and these pacemakers that connect to your smartphone, telehealth was one of the major innovations. So I just encourage all of us to have fun with it. It's a blank slate to really look at its potential and its possibilities to really do great things in the future. So thank you for having me today.
Well, I want to thank all of you panelists for taking, I know it's an extremely busy time and you took your time out to kind of share your knowledge and your wisdom and your wonderful, what I heard, some wonderful, programs that you've got going on with us, and just getting, as said before, getting out the word about how important this is and being part of this discussion. I really appreciate it. I also want to thank all the attendees who have came in today and listened to today's discussion and our wonderful panelists. And I really hope that you all have a wonderful rest of your day and a weekend. And if you all want to learn more about Molina's work in the community, please go to molinacares.com. Thank you. You all have a wonderful weekend.
Thank you.
Thank you.